Hundreds of thousands of Oklahomans in need of mental health or substance abuse treatment are being turned away for lack of insurance coverage or state programs that don't have enough funding to meet the demand. Federal laws that require equality in insurance policies for physical or mental health treatment have not brought about parity. Through a partnership with Oklahoma Watch, this is the first of an ongoing series of reports on mental illness and addiction in Oklahoma.
When the phone rings at the National Alliance on Mental Illness in Oklahoma, Augusta Cox is the person who answers.
Can I answer that? NAMI, Oklahoma, this is Augusta. How can I help?
The caller is a mother needing help getting medications to her mentally ill son who is now behind bars.
What's going on
A
with
situation that Augusta hears often. She was diagnosed with schizophrenia, and it cost her dearly.
So I'm talking to my husband, we've got to get the house cleaned up because Billy Graham's coming. And then I thought I had lunch with Al Pacino, and I'm telling my husband all of this. And in about 2 weeks of the delusions and the voices, my husband left and my job fired me.
Augusta Cox is one of the few who was able to get treatment, and it saved her life.
And he got me on the schizophrenia meds. And that was 4 years ago, January. So, and I've been stable on that same course of meds for 4 years.
For thousands of other Oklahomans, the story is not so good. 21% of Oklahomans suffered from mental illness in the last year. 12% more have substance abuse problems. 70% of those adults and 40% of children who need it do not receive mental health treatment. And 77% of adults, 80% of children who need treatment for substance abuse don't get that either.
You all have a story that matters here today.
Janet Cizik is president of the Oklahoma Substance Abuse Services Alliance. She also runs facilities in Tulsa and Bartlesville that provide substance abuse and mental health treatment to about 1,500 people.
We have people who seek treatment every day that we do not have appropriate or adequate funding to help. We also have people who have insurance or maybe their insurance doesn't cover behavioral health, and so there's always a problem with access to services.
In 1996, the federal government enacted the Mental Health Parity Act. In 2008, it implemented the Mental Health Parity and Addiction Equity Act, requiring group health plans and health insurance companies to provide coverage that is no more restrictive than policies for medical benefits. But a new report from the National Alliance on Mental Illness confirms that parity of coverage for mentally ill still has not happened. Tracy Cook is executive director of NAMI, Oklahoma.
But if you have a mental illness, there is not parity. It's not equal. You're going to have limited numbers of visits. You can go see your provider. There's only a number of medications they're going to pay for, and there's only certain places you can go.
And without insurance, the only option is Medicaid or Medicare, if you qualify.
But even those services that they could access through Medicare don't pay for everything, or there might not be a provider who accepts that insurance.
Terry White is commissioner of the Oklahoma Department of Mental Health and Substance Abuse Services. She says the laws demanding parity are simply flawed.
Is that they had loopholes in them, both at the federal and state level, and they exempt small employers. Well, in Oklahoma, over 90% of our employers are small employers, which means parity doesn't necessarily apply to them.
Commissioner White says the way Oklahoma has dealt with the mentally ill and addicted is costing a lot more money than it should.
Outpatient services. The cost for that is $2,000 a year per person on average. When we don't fund treatment, we pay for it exponentially. For example, one hospital stay when somebody can't get care and ends up in crisis, $15,000.
In Oklahoma, many of the mentally ill are behind bars, which is by far the most expensive way to deal with the health issue, costing an estimated $23,000 a year per person. Tracy Cook says the amount of money the state spends for mental health and substance abuse care is a fraction of what is spent locking people up.
We are funded $53 per person who has a mental illness or addiction in the state of Oklahoma. The national average is $120 per person. That is not acceptable.
Commissioner White gives Oklahoma political leaders credit for recent funding increases, but she says the problem has become so large that the funding increases are falling well short of what is needed.
We had decades, not a decade, decades of underfunding. So what that means is when you look at our rates of mental illness and addiction, we have the second highest rates of mental illness and addiction in the nation.
Numbers that are now approaching 1 million people in the Sooner State.
What that means is it's between 700,000 and 950,000 Oklahomans that struggle each year with mental illness and addiction. Last year we reached 190,000 with life-saving services.
According to the people on the front lines of mental illness and addiction in Oklahoma, 80% of those who get proper treatment can return to normal, productive lives, instead of ending up like many others who are mentally ill in Oklahoma, wearing prison grays and living behind bars.